There are a few issues I want to inform you about with respect to the operation of esophagectomy. It's a very major operation, can take up to 4 to 5 hours to perform, and the average length of stay of a patient in hospital after surgery is between 2 and 3 weeks. And for the majority of patients, it takes about 3 months before they recover quality of life. It's viewed as a very major operation because for most patients the operation is performed in the abdomen as well as in the chest, and because both compartments are operated within, the risk of problems and complications is greater than for most other operations that are commonly performed. The major complication is pneumonia, which occurs in approximately 20% or 1 in 5 patients. In some cases, the pneumonia can be so severe that the patient needs to go back into the intensive care for ventilatory support. Another complication is the failure of things to heal properly after surgery. This occurs in approximately 1 in 20 cases, and that can sometimes lead to a significantly prolongated stay in hospital. Clearly, the most important risk of any major operation is the risk of dying from the complications of surgery. And in our series of over 500 cases performed in St. James's Hospital, that risk is approximately 4%, or 4 in every 100 patients. And that figure is consistent with the results reported from the best esophageal centres internationally. What is the cure rate for esophageal cancer where it presents confined to the area of the esophagus? Well, this depends on how early the diagnosis is and can range from an overall cure rate of 40% to much higher than that if it's been caught at an earlier stage, or if the chemotherapy and radiation therapy that's occasionally given has had a dramatic effect on the cancer.
Well, they did explain to you, what various tubes and accoutrements would be attached to you when you come out, but I have to say that was a big shock to me. There was so many different attachments to your body in terms of tubes and drains and so on, that it was quite a shock.
After your surgery is completed, you'll be taken around to the recovery room. Once you've woken up from your anaesthetic, then you'll be transferred to the high dependency unit, and here you'll spend about 2 to 3 days. During your stay in the high dependency unit, you'll be looked after by highly skilled nurses. There will usually be one nurse looking after one patient or one nurse looking after 2 patients. You'll be looked after jointly by Professor Reynolds' team and the anaesthetic doctors during your stay. You'll be attached to a cardiac monitor where we can closely watch your blood pressure, your heart rate, your breathing and your oxygen levels. After your surgery, you'll have an oxygen mask on. Over the next couple of days, your oxygen therapy will be weaned. You'll have a drain in the right side of your chest. This will allow your lungs to re-expand after your surgery. You'll have a tube in your nose that will be passed down into your stomach, and this allows us to drain any excess gastric fluid. Your chest drain and your nasogastric tube will be in for at least a week. You'll have a tube going into your abdomen, and this sits directly into your small intestine. This allows us to feed you and give you nutrition, which will help aid your recovery process. We'll start tube feeding the day after your surgery. You'll have a line going into a large vein in your neck. This allows us to give you fluids and medications that you may require during your stay. Be assured you generally won't feel any discomfort from these lines, tubes or drains. It's natural that every patient will be concerned about pain after surgery. Rest assured your pain will be well controlled using an epidural catheter. This is a small line that sits in your back. It's a very safe and effective way of giving good pain relief. If you do feel any pain or discomfort, it's important that you let your nurse know. We want you to be able to move about, deep breathe and cough, as this will aid your recovery process. So long as your blood pressure and heart rate are stable, you'll be sat out of bed the morning after your surgery with the help of the nurses and the physiotherapist. The physiotherapist will teach you some coughing and deep breathing exercises. We know this is a very stressful time for you and your family. Your immediate family are welcome to visit you at any time in the high dependency unit, except between the hours of 12:30 and 2:30 p.m, as this is patient rest period. We do restrict visitors to 2 people at a time. It's important that visitors comply with our strict hand washing rules and apply an apron when they're coming to visit you. The nursing staff and the medical staff are available at any time should you and your family have any questions. When your blood pressure and your heart rate are stable and we've weaned your oxygen therapy, you'll be ready to be transferred to the ward. Sometimes we may need to change the type of pain relief that you are receiving before we transfer you to the ward. We do need to change your pain relief. Your epidural will be stopped and you'll be put on a machine called a patient-controlled analgesia. You'll be given a button to push. Every time you push this button, it will deliver a small dose of very strong pain reliever. You can't give yourself too much as the machine is set to make sure that you only get a set dose. When you've been transferred to the ward, the high dependency nursing staff will give a full handover to the ward staff of your medical history and your progress throughout your stay in the high dependency unit. Professor Reynolds' team will then take over your care.
And then slowly but surely from the high dependency unit I began to walk, maybe just walk to the door within the unit. Then once a day I would walk down the corridor, and then as time went on I was dispatched to a regular ward, and again during that time I would walk as much as I could and then slowly built up my strength that way. And you get used to the various attachments to you, and you do find a way to be mobile in the corridor and mix with other patients, and it gets to be a more normal experience at that stage.
On day 3 you leave high dependency and you'll come to the ward. The ward is 25 beds. There are 3 bays with 6 beds and 7 side rooms. If you're lucky enough to get a side room, they're usually used for isolation, so don't be offended or surprised if you're asked to move out to allow a patient to go into it. It's a little bit different from high dependency in that you won't have one nurse just looking after you. The nurse will be looking after 5 of their patients as well. On day 7 you'll have an X-ray test where you'll swallow some liquid and an X-ray will be taken. The only reason you have this done is to make sure that your wound is healed. If the wound is healed, we'll take the drain out of your nose and the drain out of your chest, and we let you start drinking some water. As you tolerate the water, we'll progress to free fluids, but we would advise that you don't take fizzy fluids because they'll tend to make you sick. If you tolerate these, you'll move on to semi-solid diet, which would be ice cream and soup, and if you tolerate this, you progress on to normal diet. While you're progressing, your jejunostomy feed will continue until you're tolerating a normal diet, and then it'll be stopped. You'll continue with your physiotherapy. You'll be encouraged with your deep breathing exercises and your coughing, and of course we need you to walk at least 3 times a day. The dietitian will continue to see you to make sure you're meeting your nutritional requirements. You're generally discharged home 14 days after your operation. Prior to discharge, we will organise a medical social worker review just in case you feel like you might need some convalescence. This is generally for about 2 weeks, and it can be organised in your own community area so that you're not away from your family and your friends.
The thing I'll always remember leaving the hospital was, yes, that's it. I've had my chemo, had my radiation, had my surgery, it's successful, that's it. But unfortunately the biggest battle was yet to come, in terms of you expect that you're going to make a recovery, you expect you're going to get back to normal, and actually it takes quite a long time to be able to make a full recovery.
Some patients report to me that going home can be a harder time than when you were in hospital. This is because your confidence may be shook and you may feel vulnerable and nervous trying to adjust to a new anatomy. The symptoms you may experience will be weight loss, tiredness, fatigue, full very quickly, and you may experience some nausea and loose stool. However, you will have full access to GP services, public health nurse can visit, and you will have full access to our twice weekly outpatient clinics. Here, your symptoms will be assessed and we can change your medication to help you feel better.
When they come back to us in outpatients, at that point the problems for people are weight loss, and it can be as much as half a stone or maybe even more than that, and that's quite normal. It's also normal to experience diarrhea, and a lack of appetite is something that people complain about a lot. So it's really important to get into a pattern of taking little bits as often as possible. So small meals and snacks frequently during the day, 5 to 6 meals or snacks during the day, and of the right types of foods. And you'll be advised on that when you're in hospital. Also to take nutritional drinks as well as your meals and snacks, because that can help build up and replace vitamins and minerals too.
And then very slowly, I mean probably 6 months before, it just began to pick up again. But then my energy levels came back and I began to feel a little better. I began to figure out what things I could eat comfortably and what things were a little more difficult. You know, so I will say that the 12 months post leaving the hospital was very difficult, and you really have to work at it in terms of what you eat and walking and getting yourself right. You know, but after that, it just stagnated for a period, and then my improvement accelerated, you know, accordingly. And I went back to work 13 months, I beg your pardon, 13 months after I was diagnosed. Okay, I didn't look very well, I still had a lot of weight off, but my weight was going in the right direction and my energy levels are coming back up. And I can sit here now, you know, probably six, 7 years now after treatment, and say I hardly recall the event. I eat everything, I have full energy, probably working harder than ever I've worked in my career. I take 1 tablet a day just to control the acid levels, and any side effects I have are just minor inconveniences rather than anything of a significant nature. So for me, the whole, you know, coming to terms with being diagnosed with cancer, going through the treatment, it's a very successful path. It's difficult. You need mental strength, you need physical strength, you need support from your family, and you need to look for help when you're not feeling well. And I think if you do those things, and I think the result of it can be very successful.